Hello, good morning everyone. My name is Asep Nurwahid. Today I'm here to talk to you about anxiety, specifically about treatment option for anxiety disorder. My presentation is divided into five parts. First, I start with definition and then the treatment option for the next type of anxiety, type of drug, and for the final, we have a summary. What is anxiety? Anxiety disorder are the most common disorder related to mental, emotional, and behavioral. Many factors contribute to the development of anxiety. The risk factors include a family history, stressful events, excessive worry, overprotectiveness, unmarried unemployed women, and poor physical or mental health. Anxiety disorders are characterized by excessive and unrealistic anxiety or worry about an issue. Treatment option for anxiety consists psychological and pharmacological therapies. All patients should receive education from a physician, including information about disorder, treatment options, general prognosis, effectiveness of the medication, common side effect, or uncommon but serious side effect, duration of treatment, cause, possibility of what will happen if treatment is stopped. What about the therapy option? Based on several guidelines regarding treatment recommendation, commonly used antidepressants, SSRI, SNRI, PCIS, and MAOYS, benzodiazepine, beta blocker, and there are some who use antihistamine and atypical antipsychotic. SSRI are recommended as first-line therapy for most anxiety disorder, although usually well tolerated after the initial start of treatment. Side effects such as headache, fatigue, and nausea are common. SSRIs should be taken after meals. In addition, the dosage should be kept low to avoid overstimulation. We move to type of anxiety. First things first is general anxiety disorder or GID. GID consists of psychological excessive anxiety, uncontrolled worry, restlessness, low concentration, or empty thought as a symptom for the physical, including muscle tension, sleep disturbance, and irritability. GID is severe, persistent feeling of anxiety accompanied by somatic system because impairment of social and occupational functioning. Diagnostic criteria for GID require at least persistent symptom almost every day for at least 6 months. Panic disorder, second type, usually begin with a series of unexpected panic attacks. The diagnostic criteria are followed by at least 1 month of persistent worry. During an attack, there must be at least four physical symptoms, including abdominal chest pain, abdominal distress, chills, dizziness, hot flash, palpitation, nausea, shortness of breath, sweating, tachycardia, and shaking. And psychological symptoms, including depersonalization, fear of losing control, fear of going crazy, fear of death. For the third is post-traumatic disorder. Traumatic event can cause intense fears, helplessness, or horror. Patients are called PTSD if they have at least one re-experiencing symptoms, including recurrent memory that cause trauma, recurrent dreams, and feeling the trauma event is repeated. And to hyperarousal symptoms, including decreased concentration, easily started, insomnia, and irritabilities. And three, persistent avoidance, including avoiding conversation about the trauma, avoiding thought about the trauma, avoiding activities that can remind of an event, avoiding people or places that evoke memories of the trauma, inability to remember important aspects of the trauma, and anhedonia. For the last type is social anxiety disorder. An important feature of SID is intense, irrational, and persistent fear. Being in a fearful situation usually trigger panic attacks. Fear of avoidance of situation can interfere with daily activities, including fear of being scrutinized by others, embarrassment, and fear of humiliation. Fearful situations include eating and writing in front of the others, interacting with authority figures, public speaking, talking with strangers, and using public restroom. So, for the last, I talk about the type of drug. First is SSRI or selective serotonin inhibitors reuptake. are usually indicated for the treatment of depression, considered as first-line therapy for anxiety disorder. This group of drugs include fluoxetine, sertraline, escitalopram, fluvoxamine, and tilazodone. The important mechanism of this group is inhibit serotonin transporter and cause desensitization of postsynaptic serotonin receptors, thereby normalizing the activity of the serotonin pathway. Two is SNRI, or serotonin norepinephrine reuptake inhibitors, that can inhibit the serotonin norepinephrine transporters, including venlafaxine, desvenlafaxine, and duloxetine. SNRI usually used in a case of failure or indicate response to SSRI. Third one is benzodiazepine. Although benzodiazepine were widely used in the past for treat anxiety condition, they are no longer considered as a first-line therapy due to their side effects if used for a long time and in high doses. Therefore, the use of benzodiazepine is limited in short-term treatment of acute anxiety. For the last of drugs type is TCIS, or tricyclic antidepressant. All tricyclic antidepressant function as norepinephrine reuptake or some as serotonin reuptake. Although some classes of drug are comparable in efficacy to SNRI or SSRI for treating anxiety, TCIS cause more side effects and are potentially lethal in overdose. For this reason, TCIS are rarely used in the treatment of anxiety disorder. The exception is clomipramine, which may be more efficacious than SNRI or SNRI in patients with OCD. To sum up my presentation, anxiety disorder are one of the most common mental disorder which can be better for a patient or and their family. Treatment options including pharmacological and psychological. Anxiety disorders are often chronic and can reduce the quality of life. Based on several guidelines regarding treatment of recommendation for anxiety disorder, SSRI are recommended as first-line therapy for the most anxiety disorder. Important notes. First, despite their good efficacy, as I said before, benzodiazepine monotherapy is not recommended due to events and potential for abuse. Therefore, benzodiazepine are generally prescribed for a short-term treatment. SSRI have fewer side effects when compared to other antidepressants. And anxious patient is not immediately eligible for the treatment, but depending on several factors such as the patient motivation, circumstance, significant cognitive impairment, the patient response to previous treatment, as well as the presence or comorbidities on the other psychiatric disorder may affect whether he or she receives psychological and pharmacological treatment. And the most important is if you experience excess anxiety that feels abnormal, don't draw conclusion on your own. See a professional. Before I end this presentation, let's analyze the part of speech. One, two, three, four, five, six, seven, eight, nine. Nine aspects of part of speech, including noun, verb, pronoun, adjective, adverb, preposition, conjunction, article, and determiner, and interjection. Let's move to first page. In the sentence, anxiety disorder are the most common disorder related to mental, emotional, and behavioral. Anxiety disorder are characterized by excessive and arousing anxiety about an issue. Anxiety disorder as a noun, R is a verb, the is determiner, most is adverb, common is adjective, disorder is a noun, related is a verb, to is preposition, mental is adjective, emotional adjective, and behavioral adjective too. Anxiety still as a noun are characterized as a verb. By is preposition, excessive adjective, and unrealistic too is adjective. Anxiety is noun, about is that preposition, and as a determiner, and issue as a noun. Many factors contribute to the development. Many factors contribute to the development of anxiety disorder. Many as adjective, factors as a noun, contribute as a verb, to is a preposition, the determiner, development of anxiety disorder is a noun. So on each of the presentation page, I have color code for identified the part of speech, which contain adjective orange color, adverb is more brown color, conjunction is like a khaki color, determiner is gray, noun is baby gray, number is green color, preposition pink, pronoun more more than baby green, verb is neon green. So nah, I think this is the end of my presentation. Feel free, or if you have any question, feel free to interrupt me anytime. So thank you. This is the shorts that I cite. American Psychiatric Association, Branesky and Miller, Insomnia and Other with General Anxiety, and Efficacy on Assessment Based on Group Behavioral Therapy for Generalized Anxiety Disorder. Thank you. Thanks for attention. Sorry about my mistake. Thank you. Good morning. Have a good day.